Welcome to today's presentation, Prevention Practices at Work. We would like to note that today's presentation is provided free of charge and is available in the public domain. Also, the information presented today are the views and opinions of Susannah Burt and do not reflect the official position of HHS or SAMHSA. Please let us know if you have any questions about the information in this disclaimer. It is my pleasure to introduce our presenter today. Susannah Burt has been working in substance abuse and mental illness prevention since 2001. She has used the strategic prevention framework since 2003 and has trained on the model since 2006. With her position, it has been part of her responsibility to work with the evaluators and review data for the state and local communities for assessments. She has worked to develop an evaluation plan for environmental strategies, including policies and campaigns. In addition, she has managed the Substance Abuse Prevention and Treatment Block Grant for Utah, as well as 4 discretionary grants totaling over $30 million for prevention. Ms. Burt has chaired the Utah State Epidemiological Outcomes Work Group, SEOW, Utah's Evidence-Based Work Group, and participates on Utah's Underage Drinking Work Group, Opioid Community Collaborative, and Utah's Coalition for Opioid Overdose Prevention. Susannah currently sits on her local community's Set Care Coalition in Utah. She received her bachelor's degree from Weber State University and works for the State of Utah Division of Substance Abuse and Mental Health. I will now turn the time over to our presenter, Susannah.
Good morning or good afternoon, depending on where you're at, and thank you for joining me. We have a couple objectives for this presentation. At the end of this, I hope you would be able to identify 3 evidence-based programs that are considered model, demonstrate an understanding of the strategic evidence-based models, there'll be 3 of them, and understand what's appropriate for your community, and then where to find additional support and resources to implement the strategic prevention framework, which is what we'll spend most time on. So this is my why. This is my family. I do have 4 daughters, and it's just exciting. And in these days and times, it's been very interesting parenting, as I'm sure some of you experienced or working and doing prevention during this time. So my oldest was just shy of her 2nd birthday when I started in this field, and she just turned 21 last fall. All right, so think about some of your own do-it-yourself projects or hobbies that you like. Sometimes we have plans that exist on the internet, where you find it on Pinterest, or maybe you've come up with an idea of something you want to do. But in order to actually execute some of these activities, whether it's a quilt or a bookshelf, or if any of you took woodshop, I made a jewelry box one year, we have to have a plan. And anything we do requires a plan, really, for these. You have to assess what we already have. Do you have a saw? Do you have the nails and the hammer? Do you have the wood glue? Do you have the vices? Or for sewing, do you have, again, vices or clamps? Do you have a sewing machine or the material? You have to need to see if you can do that. Then you look at the capacity of what are you able to do? Are you able to saw? I personally hate using power tools, but I can use a sewing machine, and that's just fine. So what is it that we need to be trained on or understand? Because even if you get a new sewing machine, there may be a learning curve, right? So then we have to look at what the plans are. So with those assessments, with that capacity that we already have, we can develop a plan that fits right for us. So my skills in sewing may be inferior or superior to someone, depending on who I'm comparing myself against, but it's right for me. That's the point. So, and then as I've done projects all summer, or all winter too now, we measure twice and cut once. That's been like, if you watched any of the old home shows, that's what they say, measure twice, cut once. And then you can evaluate, see if what you've done matches up to Pinterest or your outcomes that you wanted, because it isn't always all about looking perfect and ideal. It's about what's right, again, for you and your community. And maybe it didn't work out well because you didn't have the right glue or you didn't have the right thread. That's where we assess and reevaluate what we could do differently next time. All right, so there are a few planning models. You've got the Strategic Prevention Framework, CADCA's Coalition Academy, which is very similar to the Strategic Prevention Framework. They use it, they're very, again, very similar. And then Communities That Care. We have a poll that I believe Taylor's going to put up, and I'd like to know, which model are you most familiar with? I love this. This is like watching fence, like I love watching the numbers changed. All right. It looks like most of you are saying that you're familiar with the Strategic Prevention Framework, but I am going to be say look at that, those of you who are new to our field, welcome. I'm so excited. I was telling Taylor that, gosh, I feel like I've been talking about this for almost 20 or 16 years now, and then I remember there's new people in the field all the time, and I love it. So this is great. Welcome. So we are going to spend some time. I'm going to end the polling. Thank you. We're going to spend some time talking about the Strategic Prevention Framework. Okay. This is something, again, I've been training on since roughly 2006. I've been using it since before then, but training on it since then. So we have 5 steps with some cross-cutting in that center flower. And it's assessment, capacity, planning, implementation, evaluation, and then again, making sure we look at in every step, sustainability and cultural competence. Okay, so this is where I have to show my taskbar. I am going to show a clip. Oh, I should have chosen it. If someone can, Taylor, let me know if it doesn't make sound, but I'm pretty sure it worked last time. So I'm gonna hope that it works.
To feel my body powers.
Okay. So I hope you all enjoy those kind of little, I love those little clips and I loved that show. So let's talk about science. That's what this is. And one of the things that I really love about my field, it's not static, and that we're constantly looking at new ways to evolve and become better. So we're using science. It isn't just the warm and fuzzies anymore. This is science. It's been evaluated. It's been tested. This we know works. So first thing, we're going to go through these steps through the flower. And the first one we're going to start with is assessment. Now, what is assessment? We use assessment, and we don't necessarily call it that, in a variety of ways in our lives. But we're looking at the different factors, the related substance abuse problems or mental illness problems, concerns, or mental illness outcomes. Mental health outcomes, the resources that we have, where are gaps, where can we learn, is everyone ready? And that leads to what we want to do for our community. And I want to share a little anecdote that I even had to explain this to my teenager yesterday as we talked about some new diagnostic tests for her. Nobody likes to get poked or prodded, but we talked about how this is important to assess to see where things are at. So that's where it's crucial that we start with assessment in our community. So it lets us know really what's going on. There are some communities that think, oh, we don't have a problem with underage drinking or prescription drugs. We're good. People go to church or people do this and we're fine. But when we look at the data and it tells us something different, that allows us to change the capacity of that community or the readiness of that community. So when we look at this data, regardless of what it is, it can help us shape what we're doing. So those questions below, thinking about what type of a substance use problem do you have in your community? What resources are there? Who's already supporting it? We don't want to duplicate. We have very small budgets. We want to make sure we're using them wisely. And the last one is, are we ready for it? If someone isn't ready for change, then it may not be time to do that specific activity. Instead, we have to work on raising awareness. So first, you need to look at creating an assessment profile. What do you already have available? Do you have a risk factor data set? Are you surveying kids or adults? There are things like, we have the prevention needs assessment, a common tool used in a variety of states. Utah calls it the Student Health and Risk Prevention Survey, but it's ultimately the prevention needs assessment tool. That looks at the risk factors and the substance use and mental health outcomes for our youth. In Utah, we use it 6th, 8th, 10th, 12th graders. Other states can do census. You've got monitoring the future that can give you a state level image. And you can even do your own survey with tools from other things like Community Care has a tool you could use to survey your community if you don't have the prevention needs assessment or another statewide assessment available. So looking to then say, you're looking to define your community. If you are looking at a state, the monitoring the future or some of the household surveys data would be great. But if you're looking at something sub-state, a smaller city or a county, that's where you need to get some more people involved. Maybe they have something at the school district to share, okay? And it allows you to see what's already being done, who can support you. I would always encourage you, never do it alone and don't try to reinvent the wheel. So if you think you need a new survey, check and make sure something's not already being done first. But perhaps it isn't being done. There may be a county that isn't participating in the state level survey. Find a way to see if you have support from community members, especially our key leaders, such as our mayors or city council or superintendents, to see if they could help you and maybe put in some funds for that as well. Capacity. This is one of those buzzwords I feel. There's a lot of people talking about capacity and building it, and it's important. It's our ability to do things. So whether it's funding capacity or human capacity, so having the staff or the support, having the resources or training capacity, so having the skills, and then having someone to do oversight and review and evaluate. That's another capacity that you may have to build, because I'm not an evaluator. I can look at data, but I'm not an evaluator. So I instead contract that out. But you may have someone in your community or your state that could do that for you. And that's important. Just a moment. I'm going to see if I can turn up some things first. All right. Okay, so let's go on. Why is it important? As you may tell, I can tell, I like a lot of movies. I watch a lot of movies, and COVID's been really hard because no movies are coming out. But there are some things to think about with capacity when we're looking at the example of Avengers Endgame. It wasn't just one person that did everything. It was a group effort that weakened and addressed the situation. And I'm not going to do any spoilers if any of you haven't watched it. But it's essential. It's essential to have multiple players so that you have another agency that's supporting you or that's going to help you implement your plan that you're going to do. Okay? This is, I can't stress it enough. Don't do it alone. So, thinking of like Martian, so you have Matt Damon up in Mars by himself, you would think, oh, he's doing it by himself, except that he didn't. He was very smart and very industrious, but he used the resources he had. And there was stuff written by other people that he went through. And he also eventually got access to support what he needed to give him support from Earth through technology. So when we're looking at building our capacity, make sure that you're looking at what resources you have, who's already engaged, who's supporting you. Do you have stakeholders that really support prevention services? Are there ones that are really, I don't want to touch prevention services? engage those that are going to support you, obviously, and help bring those who are resistant on board. And when you have a coalition, and I think if I say that term coalition, that is multiple partners from different sectors of the community. So it may be the school, government, youth groups, faith organizations, social service organizations, your own agency, and volunteers. All of those come together, and that is the kind of capacity that would make it successful for a coalition. That last bullet, focus on cultural competency, sustainability, and evaluation. You will have turnover. Another example I've used in other trainings, my sister works, so I work in the public field, my sister works in the private field, and she builds boards of agencies like, I think your local hospital has a directing board. It takes up to 18 months for her to get someone on board, and they're paid. But that's the sustainability. She knows that people are going to be turning over and leaving, and you'll have to retrain and build that capacity. So if you know that for a grant, you have 3 years of funding, and you know the second year or halfway through, you're going to have turnover, or you potentially could have turnover, you will still want to budget some of that training money there still. So keep that in mind. And also the cultural competency, make sure your coalition or your partners reflect your community. It doesn't make a lot of sense to bring one group together and eliminate others that really need the services as well in your community. All right, I have had this conversation in the last week several times. Please make a plan. You would take the information you got from the assessment and the capacity build to write this plan. You want to have those SMART objectives where you have something measurable, something that's realistic, something that you can do, and having the right targets for your community. What's right in Wyoming may not be right for Utah, or what's right in one county within the state may not be right for an urban county in the state. Look at what your community can really address and affect in a reasonable amount of time. Just as a fact to keep in mind, when you're looking at risk factors or protective factors, you're looking about 2 to 5 years. If you're looking at community level outcomes, so you're looking to change perhaps overdose deaths or consumption rates, that can take 5 to 10 years. So keep that in mind as you write your plan. So your plan lays the groundwork. You want to make sure that you're identifying your strategies, what you're going to do, who's going to do it, and even evaluating, which we'll get to in a minute. But make sure you keep all of that in your plan. Another component I want to remind people is that if you go through the assessment and capacity phases and you see that your community needs a specific program, but you don't have the funding for it, put it in your plan anyway. Why? Because maybe you'll have a group on your coalition or another partner that can say, hey, why aren't you doing this strategy? And you can say to them, we didn't have the funding, but we know that we want to do it eventually because it's what is right for our community. And that's how you get things funded. So always write a plan for what's right for your community, not just for the funding. I can't stress that enough. And always look at evaluation. That should always be budgeted in there as well. And when you're looking at strategies, you're going to pick an intervention of evidence-based interventions. You can do it in a variety of different environments, pardon me. So you can do it as an education-based program, which might be something like life skills or a parent education program. There's school and community bonding activities, which also might be things like mentoring or the social development strategy. Communication and public education, which might be some marketing and media advocacy. So there might be a campaign there. And that one you might use if you have to raise awareness. If your community isn't ready to do specific strategies, you just need to raise the awareness. That's something that you would do. And then you look at policy. Are there policies? I know in Utah, an example is down in southern Utah, some of them, some of the communities, so cities and counties, worked with their youth to address some of the ordinances within their communities to decrease the number or the density of electronic cigarette or vaping stores in their area. And that was a huge change. Some of them also did things with their local parks. So that's an example of policy. And then there's enforcement. If you have a policy or you have a strategy that's in place, are people enforcing the rules that already exist? So be thinking of, also again, really, really stressing evidence-based. Remember I said earlier, warm fuzzy. Sometimes we have ideas of things that we want to do that sound really good, but sometimes it's not the right thing. I am going to use a specific example of things like mock DUI crashes. It's not very trauma informed, and I really, really encourage you guys to make sure that what you're doing is right for your community, and with prevention, really inviting our partners rather than making it a traumatizing event or effect on those youth and the adults in the community. All right. What's already here, this again should be in the in your community, in your capacity session, but making sure you address in your programming, I don't want to put in another parenting program if there's already 15 parenting programs or family programs that are being underutilized. Maybe there's a way I can enhance it. Is there something, do we have the school on board and they want to do something? Great. Again, all these things, we have to make sure what's already there so that we don't duplicate, we aren't stretching our resources too thin, and we're going to be supportive of the community as a whole. Okay, so I didn't change this. This is North Dakota. There's actually I asked if they had an evidence-based work group. Utah has an evidence-based work group. What is that? We're a group that looks at primary prevention programming that is considered evidence-based so that we can support communities with what they need. We've reviewed some of the things that have gone on in Salt Lake that may be not in a peer-reviewed journal, but it's something that they've continued to evaluate. An example is actually Grand Families. That was one that wasn't previously in a peer-reviewed journal, and they did enough of the evaluation to see if it was effective in their outcomes, and it was. So those are the things that our evidence-based work group does. There are other resources out there. I do want to stress that just because you see it in USA Today or in a specific article online, that doesn't make it a peer-reviewed journal. Go back to the primary source, see if it's an appropriate citation, and that link on the bottom I found really useful. So that angelo.edu, they kind of identify some of the peer-reviewed journals that are out there. So I thought that was really, really helpful. Here's some other registries, blueprintsprograms.org, that is housed in the, is it University of Colorado or Colorado State? I apologize, Colorado. But they have what we call the gold standard here in Utah because they have such a rigorous evaluation of the programs. There's also OJJDP, which is the Office of Juvenile Justice, and I can't remember what DP means, programs, but they're looking at some of those dropout programs or things that may be a little more indicated service based. And then you've got the communityguide.org. There are resources there. If you have questions, you can always reach out to the Mountain Plains PTTTC as well. They are a wonderful resource to ask for. All right, I feel like I'm speeding through. All right, so we're going to talk about evidence-based programs. So in the poll, we're going to say what evidence-based programs in your community. So if you can use the chat box, and I'm going to look at the chat box, if I can open it up. Look at that. So let me know what programs, why can't I see this? There we go, Green Thumb Initiative, I haven't heard of that one. Brainwise, Assist, oh, I've heard of Assist. Project Northland, Catch My Breath, okay. Life Skills, Good Behavior Game, we're utilizing both of those in Utah. Sources of Strength, that's a great one. Triple P, now it's coming in all of a sudden. Botvins, Catch, QPR, Nurse Family Partnership. All of these are fantastic ideas, and I don't know all of them. And honestly, if I didn't know them, you know where I'd go? To those websites that I was looking at, or I'd look it up and see if there was any information on them to see if it's considered evidence-based. Because again, some of these are really great, but we want to make sure that we're doing something that's science-based. When we work in prevention, we are constantly trying to show that we are science-based, we're evidence-based, and we produce outcomes. And just because someone doesn't go to treatment, so you don't have that number of how many people didn't go to treatment, we are changing our communities. Oh, these are good. Look at these. I'm gonna have to look at some of these later. So I'm gonna end the polling. Thank you. And I'm gonna close that chat box really good. Oh, look at those. So you guys have a great basis for this. I'm very excited to see that. All right, so we're going to talk about a couple of them, those first four. So Botvin's life skill, and I noticed some of you in the chat box had said that you'd seen it. So here's an example of an evidence-based strategy or program. This program has done the quasi-experimental evaluation of their program. They've seen, and that's where this chart that you're seeing on here is from. They could compare those who didn't receive life skills training and those who did receive life skills training, and look at the significant changes and reduction of substance uses among those participants. So we in Utah have actually done, we have it in 8th and 10th grade statewide, as well as this year we're starting to implement it in, I think, 4th or 6th grade, so it's elementary. The best data is for that 6th grade population, so I would encourage that. That's my own little pitch. But the other thing to know is that when you go to life skills training, they are so accessible. We talk to Craig Zettel all the time. In fact, I just talked to him last week about some of the things with life skills that we're looking to do. And during COVID, as we've had changes and adaptations to these evidence-based strategies, working with the developer is crucial to make sure that we're implementing it properly and that we're still getting good outcomes. And they've been able to do that. Craig has allowed us to work with them, and they've worked with our teachers and our audiences to improve the implementation. Another one, this is a little different approach, but it's the Nurse Family Partnership. It has fantastic outcomes. I couldn't get a good picture. It was really detailed, but I would encourage you going to the nursefamilypartnership.org. They've got all the research there. But this one is a nurse, so you'd need someone with a license versus Botvins. You don't have to have a license provider teaching it. This one requires that a nurse is visits with first-time parents from pregnancy to the 2nd birthday. It has great outcomes on the neonatal abstinence syndrome. For those of you who have opioid crisis in your community, that's something that is coming up. We've seen an increase in Utah, and I'm sure other states are having the same kind of outcomes. So, okay. And then guiding good choices. This is fantastic because, again, during COVID, we have to adapt. They have done some virtual trainings. There are barriers, and we talk about cultural competencies or availability for communities. If someone doesn't have access to an internet, that's an issue. So it wouldn't be great to try and do just virtual, but you may only have that option at this point in time. But it was great watching it, the Zoom breakout rooms, and I got to participate. And we brought in my kids during it. So I had my kids sit here and we participated on virtual training. It was great. And you can do it for universal or selective populations. So if you wanted some research, there's the SDRG, so the Social Development Research Group did some reports and research on it. We've also in the state of Utah are using some of the curriculum, and we're trying and evaluating some of the texting, seeing those messages and the thoughts from the curriculum, if it works well enough and has good outcomes with texting. Stand by, I'll let you know if that comes out well. But right now, that is not an evidence-based utilization. That's our testing group, which you can do, by the way, as long as you evaluate. And the last one we're going to talk about is Prime for Life. So Prime for Life has generally been used as a class, an education class for those who have received a DUI in states. The other thing, though, is that they've actually increased or adapted and added another module for cannabis. And it's a separate section, but it's still there. And you can still see a change in the outcomes, whether it's cannabis or alcohol use among those who participate. The best data they have is actually on recidivism rates, meaning those who have had a DUI are less likely to have another DUI and present again through the courts. So, but it's there and it's fantastic. Okay. Implementation. So a lot of people just jump to the idea of like, hey, we're just going to go do the program, but we're not actually thinking through. So in your strategic plan, writing an actual action plan is part of that plan of how you're going to implement the strategy. Who's going to do it? You know, allowing you to also put in there the evaluation plan. Who's going to do the evaluation? Those are key points. Without having that plan, the implementation plan, you may run into turf wars. You may run into people being concerned about how you're spending the money and reaching out to the right populations. Because you may say, hey, we're going to provide it to Box Elder Elementary School, and we're going to have the teachers teach it. But if the teachers aren't on board, it's not going to work. So you really want to make sure that your implementation plan has some ability or has had people a part of that discussion rather than just dictating and say, we're going to do this. So, so crafting your detailed action plan. I'm going to say, this is what I'm going to just skip this slide because here's why. Go to, here's why we want to do it.
Get out of here. We're going to need to get into that watchtower. And to do that, I'm going to need a few things. The guards wear security bands to control their ins and outs. I need one.
Leave it to me.
That dude there, I need his prosthetic leg. His leg? Yeah. God knows I don't need the rest of them. Look at the juices. All right. And finally, on the wall back there is a black panel, blinky yellow light. You see it? Yeah. There's a Quarnix battery behind it, purplish box, green wires. To get into that watchtower, I definitely need it.
How are we supposed to do that?
Well, supposedly these small bodies find you attractive, so maybe you can work out some sort of trade.
You must be joking.
No, I really heard they find you attractive.
Look, it's 20 feet up in the air and it's in the middle of the most heavily guarded part of the prison. It's impossible to get up there without being seen.
I got one plan, and that plan requires a freaking Quarnix battery, so figure it out! Oh! Can I get back to it? Thanks. Now, this is important. Once the battery is removed, everything is going to slam into emergency mode. Once we have it, you got to move quickly. So you definitely need to get that last. Or we can just get it first and improvise.
I'll get the armband.
Right.
That's what we do, right? We do a lot of improvisation. And that's why, again, why we want to have the plan. And that's an example. Sometimes we do things out of order. We used to do back in the day, and I will say that we would find a program we thought sounded really good, and then we'd go find a way to support implementing it. And sometimes it worked out. It was the luck of the draw. Sometimes, though, when we would implement it, it didn't work out. And it was crazy and chaotic. And that's what we want to avoid. And sometimes it didn't give us the right outcomes that we wanted. Because honestly, when we start implementing programs, if the community isn't ready, if it's really not the right program for our community, we're not going to see the outcome results that we want. So that's why we need to make sure that you're looking at what and how you're going to implement and have a plan. All right. Evaluation, okay? I say this is hard and difficult for some people because it's hard to say if you are emotionally involved, you don't want to get rid of it if it doesn't work, right? That's why we still have certain programs that still exist. So you're looking at not only outcome, which may be the change in the risk factors or change in the outcome data like substance use consumption rates or mental illness rates. There's other that process data. How many people participated? Did you get the right audience? Did you get parents of this age group? Did you reach the population that was in the most need? Because we know that for some of the parenting programs, those who participate voluntarily aren't the audience that necessarily need it the most. Everyone can use a parenting program, really, but it may not be the audience in your community that needs it the most. So how are they getting there? So those are the kinds of things that can be included in process evaluation. Then you also still want your outcome data, whether it's a change in the risk factor or in those substance use rates. It could also be a review of that policy. There are some great sources like Safe States that help you evaluate policy. And then you can say, how do we get better? How come we didn't have parents of the 10 to 14-year-olds participate, but we had parents of 5 to 9 participate? You know, those are the things that we're looking for as well in our evaluation, not just if it changed the outcomes. So again, we need it because it tells us what works and what doesn't work. If you try to implement a strategy that is, again, trying to reach parents, they work, doing it in the middle of the school day because that's convenient or the work day isn't going to work well with reaching that population. And maybe when we start to evaluate, we can see what works better for our community. And again, what works in North Dakota may not work in Wyoming or in Colorado, or urban versus rural, or those who have a higher tribal population versus white. Those are things that you want to look at, and evaluation helps. Okay, you accomplish this also by planning and keeping in mind that while it's the last step, it's right next to in the flower, and I'm going to show you in a minute, the assessment. Don't skip this. When you start doing your assessment, that's giving you the basis for your evaluation. You can use some of the same data sets from your assessment in your evaluation. So the prevention needs assessment data, we use that not only for our assessment, but evaluation. Also, please write a report. Why? Because you want to share that evaluation outcome, good and bad, with those who are supporting you, your partners, your key leaders, your funders, your own agencies. And it isn't just for you and your team. It could be your law enforcement, letting them know that like, this is why we want to support you. Or it could be your city council or your schools. But please do not skip it. So there's a joke here in Utah about how the SPiff is not linear. But one of the things is that I will eventually get this as a tattoo. I don't have it as a tattoo, but maybe one day. We got into prevention because we all wanted to make lots of money, I'm sure. But taking the time to see what our communities need is crucial. And it will benefit all of our communities and our states in the long run. But I had a question, and we're going to do a poll. The first one is, where do you think most communities or agencies spend their time? So looking at the multiple levels, where do you think they spend most of their time? This is great. Again, this is like, I don't know if maybe I've driven a hybrid car, when they tell you all the different, like, if you're using your battery or not, this is the same kind of like, it feeds something in my brain, looking at that change. Oh, look at this. All right. I'm going to give just a second longer. Okay, so people are pretty split in thinking that it's planning and evaluation. Well, that's good. I think that's a good start to know. And then you've got, the next one would be assessment, and you've got capacity evaluation, and sadly that sustainability and cultural competence is so small. All right, so now here's the next question before we talk about it. Where should communities or agencies spend the most time? So that's the next poll. Wow. Okay, look at a little different. Look at that good variety now. I love how you guys are doing this. This is splitting it almost perfectly, because guess what? Yeah, you should start with that evaluation and assessment, because that's where it's going to give you the data. But that planning piece, the implementation is going to be probably where you spend the least amount of time, because it's something that you don't want to skip the step, but you're doing it, and you can spend a year implementing, but you're still going to be doing the assessment, evaluation, and planning throughout the year. So those are crucial things. But I want to highlight the sustainability and cultural competence. So bless you all that said those are the places to be, because people forget about it, honestly, and it drives me nuts. Thinking about, if you're going to do all of this work, you're doing the assessment, what if it costs you $10,000 to do an assessment? If you don't have the money to continue this, then it's no point in continuing. There's no point. I mean, there is a point, because you really want to do some good work, but you got to be looking at sustainability. Oh, thank you. All right, I'm going to shut that right there. That's awesome. Thank you. And again, I just want to point out, your community may already have a lot of stuff with assessment. So you may not have to spend as much time on assessment, but you do have to make sure you budget for the evaluation. And you may have places that have lots of capacity, but that planning is where you should spend a lot of your time in incorporating that sustainability and cultural competence. So in this lovely presentation, there's no way that we can adequately address cultural competence and sustainability, but they are very crucial. So I want you to be thinking of how in each step, we're not going to ask a poll, but how would you incorporate cultural competence or sustainability in each thing? In assessment, are you asking the right people the right questions? Are you engaged? Are the questions written properly? I love the slide. I was telling Taylor and Shannon earlier, I really loved the slide at the beginning of making sure our words matter. And it's something I'm continuing to work on. We learn and we can adapt. And that goes to the terms I've learned. I've used cultural humility a lot in the last probably 10 years, and I love it. It's approaching your communities and those you work with or are educating with humility. I will never, ever know all there is to know about the Navajo Nation, but I can learn key points so that I'm not being horribly offensive, right? And then you look at the responsiveness. And when you talk about responsive, culturally responsive, and I think that I just saw a training on it. I just found it like this last week. It's responsive. Once you learn something, you can adapt and change and get better. And that's what prevention's all about, right? We want to grow. We want to be better. We want to not be exclusive. Are there better ways? There is a term versus marijuana versus cannabis. And there's a lot of things that come with using the term marijuana versus using cannabis. And you have to see what's right for your community and weighing that out. And that's something that I'm working on. And sustainability, if you have a grant, again, that's time limited, because in prevention, we tend to chase the money. If we can get new grants to sustain us for another 3 years, that's usually what we're at. But having something that maybe your city's funding or your school district's funding constantly, it's in their budget, That would be sustainable. The other thing that I've reminded people years ago is that it isn't about sustaining your job unless that's crucial to the implementation and the evaluation of that program. It's about sustaining the outcomes. If you can get to a point where a teacher is teaching it as part of their weekly curriculum and you don't have to teach it anymore, that can be sustainability. It could be that somebody else is going to take it over, so you could have the hospital be providing it instead of the local mental health authority. Those are ways of looking at sustaining strategies and outcomes in your community. So keep these in mind throughout every step you're doing. All right, last little bit. It's a continuum. You've got things from promotion, promoting wellness, all the way to early intervention. And there's a great fan, if you ever want to see it. It's with what used to be called the Institute of Medicines, and it's now like the National Academy of Science and Medicine. Prevention is prevention and prevention. We do have different focus, but when we start looking at those risk factors and protective factors in our community, there's a lot of overlap. So keep that in mind. And that's where it is really crucial to bring those partners in with us. Our successful prevention decreases those risk factors and enhances protective factors. And we know to make sure that we have the support from the community, that we do things that are evidence-based and that we do it with science. We're going to science crap out of it. So last thing, where can you turn for more assistance? Mountain Plains PTTC, CADCA, they have a conference that goes on, they have twice a year, one's next week actually, and then they have another one in the mid-year. They also have a Coalition Academy. It's a little pricey, but it's something that's I would consider if you have funding for. You've got regional support. So in Utah, we've got regional directors. You've got, again, Mountain Plains. You may have other state agencies or contractors to support you. And there's also myself. So if you have questions, feel free to reach out to me or through the Mountain Plains PTTC to get a hold of me. I have both my personal email and my work email. So there.
Thank you so much for joining us today for this presentation.